When is the best time to bring your child to see a dentist? The American Academy of Pediatric Dentistry and the American Academy of Pediatrics both agree that when the child cuts its first tooth or turns 12 months old, whichever occurs first, is the best time. Now, often we get asked, well, my child doesn't have many teeth. There may only be a few in there. Part of this first visit is to help mom and dad establish what we call a dental home. We want a place where your child can feel comfortable and learn to develop comfort skills with being in our clinic. That first visit is really important, that we start exposing the child to what happens in a dental office. Most kids are familiar with what a toothbrush is, and if we show them and educate them and give them a positive experience, they'll let us take a quick peek at their teeth. How do we go about doing that? Simple. What we'll do is we'll have the mom and child come back either into our hygiene clinic or to one of our operatories. Mom will bring the child back, we'll have a toothbrush ready, and we'll have the mom pick up the child, and usually the child's facing the parents at that point. We have the child's legs around parents' waist, and then they tip the child back towards their knees. And at that point, I sneak up behind the child, and as mom's holding the hands over the child's belly, I'll use a toothbrush. Kids are familiar with what the toothbrush is, and then they'll let me brush their teeth, and we'll sneak in there and brush for a minute or so. After brushing, we'll wipe a lot of the toothpaste off, and then we use our dental mirror and our dental explorer to look around. Part of this visit isn't just teeth. We're checking soft tissues, cheek, lip, tongue, airway. Once we get done brushing and checking out soft tissues and hard tissues, at the request of moms, place a fluoride varnish on the child's teeth. And at that point, we sit the child up. Sometimes they need a drink of water. The fluoride varnish we use here, kids can eat and drink right away, and so there's not a delay, which makes it more comfortable for the child. We talk about healthy eating. We talk about brushing habits and brushing tips at home. Hopefully the child at that point still really likes their experience. We give them a balloon, we give them a coin, and try and make it as fun and friendly as possible. Some kids have a little harder time than others, and we accept that. But the majority of kids do really, really well, and we'll do everything we know how to give your child the best experience possible.